We clapped for them, they clapped for themselves. And Prime Ministers, past and present, said, promising whatever they need. But post-pandemic and deep into a cost of living crisis, reality and rhetoric have not kept pace with one another for NHS staff.
When we didn't get the pay rise, it was a smack in the face, because it was indicated that the staff, especially during the pandemic, were valued, and
Do you feel
the Prime
valued
Minister... No, not at all.
Lorraine has been a nurse for 34 years, but has now done something she never thought she would. Voted for a strike, because she says she's been driven to it.
Do you feel worse off now than you were a few years ago?
We're totally worse off. I know I'm worse off. For the first time ever, that I really am having to think before I spend.
If you were starting out now, would you take this job?
No. And that does break my heart, because it was something that I wanted to do from a young age.
It's estimated almost 2/3 of nurses are members of the Royal College of Nursing. For the first time in its 106-year history, members nationally have voted to strike. The Royal College of Nursing said industrial action would take place at all NHS employers in Northern Ireland and Scotland, and all bar one in Wales. And there will be walkouts at 121 NHS organisations in England. This is a health service in crisis, say the unions, with more than 47,000 unfilled NHS nursing roles across the UK, and thousands more leaving, they say, because of being burned out and underpaid. The starting salary for a nurse is around £27,000. The most senior can earn around £55,000. But the Royal College of Nursing said pay has not kept up with inflation for years, and is asking for an increase of around 5% on top of inflation, 17% in total. But the government said giving NHS workers that would cost £9 billion and simply wasn't affordable.
Well, we hugely value the work that nurses do, but we also need to recognise that these are economically challenging times. We need a strong economy in order to pay for a strong healthcare system, and a demand of 17%, 3 times what most non-public sector workers will receive, is out of step with the economic circumstances that we face.
Anyone that says that needs to look at what has happened to nurses' pay over this past decade. It has dropped by 20% in real terms. So what the nurses are saying to me, as I've travelled the country over this last number of weeks, they're actually living on a knife edge. And then they're getting a very raw deal when they actually come to work.
The government say they've given more than 1 million NHS workers a pay rise of at least £1,400 this year, on top of a 3% rise last year, adding they're disappointed, but contingency plans are being rolled out. Right now, hospitals across the nation are trying to work out just how they will cope with this action, because the Royal College of Nursing negotiates the level of care it will provide with individual NHS services. Accident emergencies and critical care, like some cancer treatments, will still run under what the union calls its, quote, life-preserving care model. But inevitably, thousands upon thousands of operations and appointments will be cancelled due to this strike action at a time post-COVID when 7 million people in England alone are waiting for treatment, and key targets are already being missed. For NHS workers like Lorraine, the idea of striking breaks her heart, she says, but she's been driven to it. The RCN are yet to decide when it will happen, but action will begin before the end of this year. That day, they say, will be a dark one in their history.
Well, our Health and Social Care editor, Victoria MacDonald, is with me. So what scale of disruption can people expect?
Well, NHS England sent out an email at the beginning of November to put into place what's called Exercise Arctic Willow. And basically, this is how you could describe a sort of tabletop exercise to look at where the disruptions will be, how you can keep patients safe, really to keep things running as much as possible. Now, it's not, of course, just about the Royal College of Nursing. There are any number of strike ballots coming up. GMB, Unite, Unison. We're talking about paramedics, porters, physiotherapists across the board. There is such a lot of anger, I think, out there about the pay award. The Department of Health and Social Care, on the other hand, says if you funded this, the Just Agenda for Change alone, which is some of the nurses, physiotherapists, it would cost them £9 billion. What the unions are hoping is that this disruption won't happen. And let's not forget, it won't be in all trusts because not all trusts reach the threshold for action. But what they are hoping is that the government will get round the table with not just the RCN, but with the other unions and say, how can we talk this through? All eyes, of course, too, are on next week's budget and whether there will be anything to help them out in this case.
Victoria MacDonald. Well, joining me now are Matthew Taylor, Chief Executive of the NHS Confederation, which represents NHS employers, Rachel Power, the Chief Executive of the Patients Association, a patient advocacy group, and Leanne Lewis, who's a clinical specialist nurse in the South Wales area NHS. Matthew Taylor, can the government allow this strike to go on? Because this is just the beginning, isn't it? There are lots of other groups who could also go into strike action if this becomes a big dispute.
Yeah, this is a very difficult situation. And I think as the organisation that represents leaders, employers within the NHS, we would encourage all parties to think about routes to try to resolve this issue. But it is important to recognise the context. And the context, as your report suggested, is that it's not just an issue of pay and the demand of nurses to get a higher increase, one more in line with the cost of living. It's also about the fact that we have a challenge about recruiting and retaining and motivating our NHS staff, including nurses. So this is part of a broader workforce challenge that we have got to address.
Leanne Lewis, how does it feel being in this situation tonight where you could be making this historic step to take industrial action and to withdraw care?
It's been an incredibly difficult decision to make. I did vote in favour, and it's something that it took a lot of thought. But for me, it is around the issues around retaining staff. Staff are hemorrhaging, the NHS are hemorrhaging staff. There are recruitment issues, which also then have an impact on patient care. It's an incredibly difficult time at the moment within the NHS, within the Four Nations.
I mean, a lot of people watching, of course, will be very sympathetic and huge sort of fans of nursing and nurses. But they'll also be saying, we've also had real terms pay cuts over the years. We're also behind where we were in 2010. And we've all got to take some pain. Are you sympathetic towards that at all?
Of course I am. And myself, I had a pay freeze for 10 years. During that time, I still had to pay my mortgage. I still had to pay bills. The issue is at the moment is that nurses now, with the cost of living, we are taking a hit just like everyone else. And because of the issues and the pressures within the NHS, staff are finding that they're leaving and they're going to work within the private sector because they can do the same job for double, sometimes triple the wage. Yeah. And they don't have they don't have the stress, they don't have the burnout. That's the issue.
Rachel Power, I mean, a lot of patients, especially those who are in chronic conditions, requiring regular appointments, regular care, can be very worried at the prospect of this, aren't they?
Yeah. At the Patient Association, our concern is always focused on patients, and whilst acknowledging how hard healthcare staff worked during the pandemic, patients have had a really tough time waiting for treatments and continue to wait for treatments on that elective list. So, right now we're calling on the NHS and the government to make sure that they work in partnership with patients so that patients really understand what contingency plans are and what's going to happen to those treatments that they've been waiting for during this period.
I mean, Matthew Taylor, what are these contingency plans? Because agency staff are being told don't go into work on those strike days. So who's going to do it?
Well, the first thing is it's important to emphasise that the trade unions are committed, the RCN's committed to maintaining emergency and critical services. But I don't think anyone can pretend that there won't be disruption. And I think, as Rachel said, the really important thing is that we try to ensure that patients are told if procedures or appointments have to be cancelled, that we try to minimise the impact on patients. But it's a difficult time for the NHS anyway, because we face a gap between the demands placed on us and the capacity we've got in terms of staff, in terms of the quality of our buildings and our estate. So, we all knew, and we've been saying for a long time, that winter was going to be very, very difficult. So what we're going to be asking NHS leaders to do, and they are making these contingency plans, is, as well as managing that capacity gap, as well as managing the winter pressures, they're going to have to do everything they can to minimise patient harm if this industrial action does indeed unfold.
Now, part of the problem in terms of the mechanism is that the government says it's following the pay review body recommendation, and that and it's up to that. Do ministers now need to basically bypass that process and say, let's just sit down and work out a pay deal and do it urgently?
I think if you look at the pay review body's recommendations, there was a recognition there of the deeper workforce challenge that we face. So, you make recommendations within a kind of envelope of how much is likely to be available from the government. But when you've got, as we do, 130,000 odd vacancies, nearly 50,000 vacancies for nursing across the UK, even if this industrial action was not taking place, we would have to be addressing the question of how we recruit the nurses we need, how we retain the nurses we need, and how we motivate them. Because, as Leanne has said, and I hear this from every nurse that I speak to, it is partly about pay, but it's also about the intensity of the work and having to cope very often in situations where nurses are working in teams which are not fully staffed.
Well, Leanne, you talked about how difficult this decision was, but obviously a lot of nurses have also voted against strike action. So how divisive is this within nursing?
That's a difficult question to answer, because I've been nursing 27 years, and this was something that I never ever thought that I would vote for. Certainly, when I went into nursing, the thought of striking was unheard of. I think obviously there's going to be people who voted against it, but I think for many, nurses are just, enough is enough. We're still dealing with the aftermath of the pandemic. There was vacancies then. There's even more vacancies now. And for myself, all I can say is, I voted because I was so upset of seeing friends going home crying because they were literally at their end of the tether. They were working, hours after their shift because there was no cover there. And there's only so long that individuals, nurses, porters, doctors, healthcare workers, that they can maintain that.
Just finally and briefly, Rachel Power, do you think most patients are going to support the nurses?
It's a question I can't answer because we haven't asked it. But I think what I think all patients will want is that all parties get around the table to try and resolve this and to support the call that the Patient Association have with the support of patients, that there is a fully funded workforce strategy that looks at that recruitment and retention of nurses and healthcare staff.
Rachel Power, Matthew Taylor and Leanne Lewis, thank you all very much indeed.